I'm joined by Vicki Ringer, Director of Revenue Cycle at Hunter Health. Vicki is joining our upcoming Revenue Integrity Program, taking place Tuesday, March 26th, on a panel dedicated to leveraging technology and data analytics in improving revenue cycle performance. Vicki, thanks so much for coming along today. To begin, would you share a little bit about your own professional journey, both how you got your start in the healthcare industry and some of the roles that you've enjoyed so far?
So my start in healthcare came from actually wanting to work from home and realized that coding and billing were something that I could do from home. However, since I had no experience in it, I decided to go to school, study, and get my coding and billing certification. So that was kind of where it all started. And I did work from home for a short bit, but decided that I actually liked the office camaraderie and just working with people and feeling more connected. So I started taking position within an office setting. And from there, I went from coding and billing to working on denials. And then from there, just kind of worked my way up to a team lead. And then had some various jobs at various different organizations throughout the years, but continued want to just kind of take on more and learn more. So just continued to dive in even more and want to learn more, build upon my skill set that I had. I had a great mentor at one point that she told me, she's like, this isn't just a job for you. You have a career in this. She's like, you just have a natural ability to do this. And it's like, I found it. And like, how many people are lucky enough to like find what they love to do and that they have a natural ability. And so I just I'm lucky to have this job and the positions that I've been in. Everything has just always worked out well for me.
Well, that's wonderful to hear, and I'm glad that you've found a mentor who really helped you in your career. It's always great to hear about positive managers who've helped people along. That's really terrific, and that you're really passionate about this work. Tell us about some of your key priorities with your team at Hunter Health at the moment. What are you working on there?
So key priorities right now are, always usually based around revenue, but right now we're looking at increasing our revenue through our third-party payer contracts. So we are in the process of gathering all that information, what we're being paid for fee-for-service lines, in comparing them across, either other facilities or to other payers to make sure that we are maximizing our reimbursement. The other thing that we're doing is we are looking more at our coding as well, making sure that we are maximizing and using the codes that we need to maximize the revenue that we could possibly get back. So those two are like really huge that we're kind of working together on and doing that at the same time, just to ensure that, we're in compliance with each step along the way. So another thing that we're looking at as far as increasing revenue is also starting new service lines within our organization. So we do have a few that are getting ready to start in 2024, and we're excited about those. So I think that, all of that together is just going to, it's going to put a lot on the team, but they are a great team and are really excited about some of these changes that are coming too.
Well, it certainly sounds like a really exciting time at the organization and a lot of big projects to work on. Of course, I'm sure that using technology and data analytics is going to be a big part of that, managing your contracts and really looking at those contracts. And that's the topic you'll be joining us on in the upcoming meeting, the Revenue Integrity Program, taking place this March. Tell us one thing you're looking forward to discussing with the other panelists or with the audience members.
So one thing I have always been big on is utilizing the technology that you have to its maximum potential. A lot of organizations pay really big money for their EMRs, EHRs, and there's so much that they can do that, a lot of people just don't understand. So I think just utilizing what you already have is always really important. Understanding what you do have, understanding the limitations of what is there, so that way you know what to be looking for. if you do need an add-on service or you do need something else to help supplement that, understanding the limitations that are already there will help you because, I've been to, big conferences where, they're showing the latest and greatest of like AI that all AI has to offer in RevCycle. And it's absolutely amazing, but if it doesn't integrate with your system correctly, or there's just these limitations that may happen where this brand new shiny thing, it's not going to work the way you want it to. So utilizing kind of what's there, utilizing the analytics if you don't understand the data that you already have, um, adding something new isn't going to help. So there's a lot of understanding what's already there in order to kind of move your organization forward.
And I think these are all just such great points. I mean, knowing what you know, what data you have that you can use to leverage, and also using your technology really to its maximum capacity is such an important factor for revenue cycle teams as we look to be more efficient and to be cost effective. And we'll really look forward to discussing that with you and the other panelists and the audience during the upcoming meeting. Thank you again for coming on today, and we really appreciate it.
Thank you.